What is inflammatory breast cancer? Inflammatory breast cancer is a rare form of breast cancer. It is often an extremely aggressive cancer that can grow and spread quickly, sometimes within days. According to the National Cancer Institute, inflammatory breast cancer only accounts for 1 to 5% of all cases of breast cancer that doctors diagnose in the United States. Keep watching to learn more about the symptoms, treatment, and prognosis of the disease. Signs and symptoms. Many kinds of breast cancer often begin with a lump in the breast. Inflammatory breast cancer, however, usually starts with the breast feeling heavy and appearing red and swollen. Other symptoms of inflammatory breast cancer include redness affecting 1/3 or more of the breast, which may become more pronounced and then seem to fade, swelling or rapid growth in the breast, a breast that feels hard to touch, noticeable aching, tenderness or hot feeling in the breast, a nipple that seems to flatten out or more sideways. Changes to the skin of the breast, such as developing hives or welts or an orange peel texture. Differences from other forms of breast cancer and mastitis. The reddish color of the breast that doctors associate with inflammatory breast cancer is one of the main differences between this and other forms of breast cancer. Other breast cancers usually start with a lump in the breast and have no color change. However, people sometimes mistake inflammatory breast cancer for another kind of cancer that has progressed significantly at one site. Mastitis, an infection affecting breastfeeding women, has many of the same symptoms as inflammatory breast cancer. While mastitis will improve with antibiotics and the redness resolve, inflammatory breast cancer does not improve with antibiotics. Also, fever is not typical in inflammatory breast cancer but can be a symptom in advanced mastitis. Causes and risk factors. According to the American Cancer Society, inflammatory breast cancer occurs in people under the age of 40 years old, which is younger than for other forms of breast cancer. African American females have a higher risk of inflammatory breast cancer than white females. When to see a doctor. Because inflammatory breast cancer is so aggressive and invasive, people should see a doctor for evaluation if they notice any persistent changes in their breast. Signs that it is time to seek medical care include swelling in the breast, itching, swelling, heaviness or redness in the breast, changes to the skin of the breast that starts to resemble orange peel, inverted nipple. These symptoms could also indicate an infection, in which case a doctor may prescribe antibiotics. Individuals who receive such treatment should monitor their symptoms, and if they do not see improvement within 7 to 10 days, they should request further test. Diagnosis. The first step in diagnosing inflammatory breast cancer is usually a biopsy. A doctor removes some tissue from the breast for examination for signs of cancer. There are two types of biopsy. Number 1, skin punch biopsy. Doctors often use this when they suspect inflammatory breast cancer. This approach captures the skin and deeper layers of the breast tissue. Core needle biopsy with ultrasound. Using high-frequency sound waves, a doctor inserts a hollow needle into the affected breast and removes tissue to test for cancer. If doctors detect inflammatory breast cancer, they will require more tests to see if cancer has spread. This test will also determine how far the disease has spread from the original site. An MRI is particularly helpful for imaging inflammatory breast cancer. Other tests doctors use to find more information about the status of an individual's inflammatory breast cancer include chest X-ray, CT scan or other staging scans, bone scan, liver function studies. Prognosis. Inflammatory breast cancer is a very serious disease, but new and improved medical treatments have led to better management of the disease. However, because the disease is so aggressive and spreads so rapidly, the survival rates for inflammatory breast cancer are lower than other types of breast cancer. The American Cancer Society states that inflammatory breast cancer has already spread to other parts of the body by the time doctors diagnose it in 1 out of every 3 cases of the disease. For the purpose of estimating survival rates, the American Cancer Society referred to inflammatory breast cancer as localized, meaning the cancer does not appear to have spread outside of the breast. Regional, meaning the cancer has spread beyond the breast to tissues that are close by or to the lymph nodes. Distant, meaning the cancer has spread to distant areas such as lungs, liver or bones. The American Cancer Society advised that the corresponding 5-year survival rates are regional 52%, distant 18%. Inflammatory breast cancer is a rare and aggressive form of breast cancer. The most common symptoms are redness, swelling, itching and heaviness in one breast. Because the disease tends to be well advanced before diagnosis, current survival rates for inflammatory breast cancer are not as encouraging as they are for other kinds of cancer. However, ongoing research and improvements in care can make a difference in treating the disease.